Morning. The committee will now come to order. The committee is meeting today to hear testimony on the impact of the end of Medicaid funding for the insular areas under the Affordable Care Act, also known as the Insular Areas Medicaid Cliff. Under Committee Rule 4F, any oral opening statements at hearings are limited to the chairman and the ranking minority member. Therefore, I ask unanimous consent that all other members' opening statements be made part of the hearing record if they are submitted to the clerk by 5 p.m. today. I ask unanimous consent that the gentlewoman from the U.S. Virgin Islands, Ms. Plaskett, be allowed to sit on the dais and question the witnesses. No objection. Hearing no objection, so ordered. Good morning again, everyone. The Mariana Islands, which I represent, and the 4 other U.S. insular areas all face a Medicaid cliff at the end of this year. Supplemental funding for the Medicaid programs in our areas, included in the Patient Protection and Affordable Care Act, or Obamacare as we like to call it, expires this year. And I can just recall as if it was only yesterday when Pedro Pierluisi and I enlisted the help of the Congressional Hispanic Caucus and met the president on this issue. And Senator from New Jersey joined us, and that's, I think, from that meeting, we were able to get this money because we were not included in the Affordable Care Act under the reconciliation budget process. But loss of that funding puts healthcare delivery at risk, not just for Medicaid recipients in our islands, but for the population at large. Today's hearing is meant to shine a light on that imminent crisis. I want to thank the directors of each of the Insular Area Medicaid programs for being here today as witnesses. Your programs are already short of cash, so the cost of coming to Washington was not taken lightly, I know. But I think that we could have no better spokespeople to describe how truly dire the situation is. I hope we will be able to learn from you what the loss of Medicaid funds will mean to the people you serve, real people, our people, who simply have no other means of getting basic health care. Also invited to testify today is the Chief Executive Officer of the Commonwealth Healthcare Corporation. Ms. Esther Muña runs the one and only hospital in the Marianas, and that hospital depends on Medicaid for over 1/4 of its revenue. I hope Ms. Muña will be able to tell us what the loss of Medicaid funding will mean to the hospital's ability to deliver services and how that will impact not only Medicaid patients, but all her patients. I think Ms. Muña's description of how the hospital depends on Medicaid revenue will help us understand how losing Medicaid revenues will hurt healthcare providers in private practice as well. So we are all working from a common set of facts. Let me quickly review the situation. In the states and the District of Columbia, Medicaid is an entitlement program. To the extent there is a need for services, and to the extent a state can provide local matching fund, federal Medicaid funds are always available. In the 5 insular areas, this is not the case. Up until 2011, we each received a fixed block grant. That block grant, I am sorry to say, is unrelated to the need of each of our areas. It seems to have been set rather arbitrarily decades ago. And the local match to access that block grant was set in law at 50-50. 50-50 is the same matching rate as the wealthiest states, while states as poor as the insular areas only match at a rate of 24 local, 76 federal. Obamacare provided some relief, an extra $7.3 billion in temporary Medicaid funding, and a permanent change in the match to 45 federal, 55 local. But the Obamacare money is no longer available after this year, and all the insular areas will revert to their block grants. Using 2018 data for American Samoa, that means going from $20 million in federal funding to $12 million. For Guam, from $56 million to $18 million. For the Marianas, from 25 million to 7 million. For the U.S. Virgin Islands, from 70 million to 18 million. And for Puerto Rico, from 2.3 billion to just 360 billion. You cannot suffer cuts like that and continue to deliver services. The path forward is unclear. Certainly more money is needed and an equitable matching rate. But there's also the need for each of the insular areas to build capacity to deliver care. Because ultimately, the goal is not just to have the same funding as states. What we want is medical care for those who need it in the insular areas to be every bit as good as medical care in the states. So I look forward to hearing from the witnesses for their advice and experience. Lastly, I want to report that one of the meetings we arranged for the directors to add value to their time in Washington has paid off. Some of you already know this prior to coming here. But you met yesterday with staff of the Senate Finance Committee and the House Energy and Commerce Committee. We also arranged for you to meet with administration officials at CMS, the Centers for Medicare and Medicaid Services. You asked them at the meeting to allow for Obamacare Section 1323 money to be used in fiscal year 2020, be used before you use the Section 1108 annual block grant. I received word last night that CMS has decided to do what you asked. That will make more money available that otherwise would have been lost. So if we're able to do nothing else, your trip here was rewarded. I would like to say that we will get something else done here. But I certainly do believe that your trip here and today's hearing will have positive results. And I now recognize my colleague, the gentle lady from Puerto Rico, for an opening statement. Thank you very much, Ms. Avila. We're gonna go to questionings, members who have 5 minutes, but before I do that, I'd like to ask unanimous consent. I have a set of 6 questions. I can hear all of us here speaking to the fact that we all want to be part of the full Medicare program, state-like. And so I have these 6 questions that I'm going to ask you to take home. And if you could provide us your written response within 10 days, they would become a part of the record. And it's not just a matter of money. There are many requirements that all of us, our governments, have to set up before we could become eligible for the full program, like any state or like the District of Columbia. So if I may, I have for each one of you, all of the state directors, and Helen can share with Esther and work together on responses. Thank you for all of you for your valuable testimony. The chair will now recognize members for questions. And under committee rule 3D, each member will be recognized for 5 minutes. I'd like to recognize myself for, you want to go first? Actually, I'm gonna recognize the gentle lady from American Samoa first. She needs to fly out, catch a flight.
Chairman, I yield back.
Thank you. The gentle lady yields back. I'd like to recognize myself, but before doing so, I ask unanimous consent to enter into the record a letter from the Financial Oversight and Management Board for Puerto Rico, a letter from the Association of Asian Pacific Community Health Organizations, a letter from, oh my goodness, from national and community organizations, signed by, supported by many organizations actually, at least 20, over 20. And also a letter from the Guam Regional Medical City that I've been asked to submit for the record.
Mr. Chairman.
Yes.
Mr. Chairman, sorry to interrupt. Can I do the same thing and introducing some?
When I recognize you, yeah. You
Okay,
can.
perfect.
Thank you. And so now I recognize myself for questionings. Ms. Sablan, Hafaday, Helen, welcome. I want to compliment you on how you and your colleagues, including Ms. Muñoz, managed the Obamacare money. So American Samoa, Guam, and the U.S. Virgin Islands, they have hundreds of millions of dollars of Obamacare funding unspent, but you have been able to use up all your money. Is that correct?
Yes,
And you use certified public expenditures to make the local match and release the federal funds. Is that also right?
yes, we work with the hospital to use the CPE for our local match.
And that is good because the Commonwealth government would have had to match the 109 million that we put into Obamacare with about 50 million of local funds. But the Commonwealth did not make that match, did it?
No, we did not have the money.
Interesting, actually, because all last year, the chairman of the Northern Marianas Legislature Ways and Means Committee kept bragging about how he was responsible for the biggest budget ever in the Commonwealth history. Yet he could not find matching funds for Obamacare Medicaid money. And so, again, as a result, I understand that you've had to stop making medical payments to private providers at this time, yes?
That's right.
And you also have had to stop paying for Medicaid patients to use the federally qualified Camacho Community Health Center. Is that correct?
Yes.
So could the Camacho Community Health Center also use CPE system to make the local match?
No.
Okay, so, well, I know our legislature is not paying its share for Medicaid. It's not your responsibility. You had to do the best you could with what you were given, or actually not given, I guess I would have to say, right?
Yes.
And working with the Federal Centers for Medicare and Medicaid Services, the Marianas Congressional Office was recently able to help you get another $8.2 million, but that has to be adjusted, and we could be now down at $4 million. But we also have another $36 million in the disaster supplemental appropriation, where it's my hope that you could see yourself through the end of the year. Would that help you? Help your program?
Yes, thank you, Congressman. That would be very much appreciated.
Okay, again, I want to thank you. I have a little bit more time now. Ms. Munya. Thank you also, Esther, for coming here, and thank you for helping managing this program, and of course, our only hospital. What I want to know, Ms. Munya, is how important Obamacare funding has been to the hospital. You said local funding was cut in 2010, about 40 million to 5 million, from 40 to 5 for your hospital. But then Obamacare began in 2011. Without Obamacare, would the hospital have stayed open?
I don't think so.
At the same time, you were losing local funding. You were also on the edge of losing CMS certification. Without Obamacare, would you have lost certification?
Absolutely.
Wow. And of course, if you lost certification, that would mean Medicare patients as well as Medicaid patients, as probably as well as private insurance patients could not use the hospital. Is that correct?
That's correct.
So you testified that Obamacare money made it possible to see more patients and to expand services. You tripled your Medicaid staff, your medical staff added specialty services, including oncology, implemented a quality assurance unit. Is that right?
That's correct.
And Medicaid money helped.
Yes,
improve the
absolutely.
services. And as a result of these improvements, patient outcomes have improved for our Northern Marianas patients.
Yes, and they'll be able to take it, have it at home.
And readmission rates have improved.
Correct.
You said that the hospital revenues also quadrupled during this time. It looks like the improvement in services that Medicaid made possible helped to make the hospital more financially viable. Is that true?
Yes, it is true.
So to summarize, the Obamacare that Congress provided you $109 million meant the hospital stayed open, helped you keep your certification, expand services, improve patient outcomes, and add to your bottom line.
Yes.
Okay, and my last 10 seconds. Ladies, please, the 6 questions you have, I would really like for you to respond in writing to the committee in 10 days. It's going to be part of the hearing record. It is critical that we answer that as completely and as correct as possible. Thank you. My time is up. At this time, I'd like to yield to my colleague, the ranking member, Ms. Gonzalez.
Thank you, Mr. Chair.
Thank you. We're going to have a second round of questioning, and I'm going to start with myself, please. I'm Miss Reimer Brown. You just, including in your written testimony, but you just listed a series of items that you implemented in your program, establishing the relationship between the extra Medicaid money the Virgin Islands received in last year's disaster appropriations and the improvements you made in administering the program. Fraud unit, you began reporting data to CMS through the Medicaid Management Information System. But you were able to do that because of the incentive funding included in the disaster bill. Is that correct?
That is totally correct. Without that, we would have been
That
unable.
was my next question. I think you're reading my script here, right? And without that incentive funding, you would have been able to. Would you have been able to add those state-like features to the Virgin Islands Medicaid programs?
Could you repeat that, please?
Without that incentive funding, would you have been able to do what you did?
No way, we
Okay.
could not have.
So it seems to me there's a model there for how we can add other state-like features to the territorial Medicaid programs. That if we provide incentive funding, if we give you the resources you need to build capacity, then you're willing to do it. Is that right?
We certainly are.
So congratulate the Virgin Islands on the work you're doing, and I do think what is happening in your islands could be a model again for how we make Medicaid more state-like in the other insular areas. To thank you for showing us what can be done. So let me ask the other directors very quickly, if you had upfront money to make your programs more like state-like, in terms of the services you offer and in terms of how you manage your system, would you make those changes become more like a state, Ms. Sablan?
I think so.
Okay, Ms. Archangel?
Definitely.
Ms. Young, Director Young, could your program be run like a state if you had state-like funding? Thank you.
Believe so.
Thank you. And how long do you think that would take? Could you do it over a period of 10 years? Would that be reasonable, Ms. Sablan?
Probably.
Ms. Archangel? 10 years. I didn't hear your question, your answer.
Yes.
Okay. Wow. And Ms. Reimer Brown?
Yes.
And of course,
Yes, I think that's reasonable.
Ms. Avila, I'm not ignoring you. It's just that Puerto Rico's program is so huge. But would you also be able to do these things, and some of which you are already starting to do?
Yes, the answer is yes. Thank you.
Okay. Look, the fact is that the federal government isn't saving money by not treating the territories equally in Medicaid. It has been a big factor in many territorial citizens moving to a state. So for example, many Puerto Ricans have abandoned territory for a state that is more than 3/5 of all people of Puerto Rican heritage live in the states. Further, Medicaid programs in the states spend multiples per beneficiary of what territories spend. In the case of Puerto Rico, 3 times as much. They're not treating us the same. They're not treating anybody differently. It's just an issue that. Yeah. So they're not saving any money, right, Ms. Avila? We're not giving you the money. The federal government is not saving money because your citizens move to Florida and.
I will say that it's more costly for the states to have our residents here.
And also costly to us because we're leaving we're having our people live home. And again, I cannot overemphasize the importance of your written response as concise and as complete to the 6 items I gave you. Those are going to, again, go into the record. It will be shared with the Committee of Jurisdiction, Energy and Commerce, and it is a plan that would allow its territory to work through a program, get financial incentive to do those things that require us, that will get us hopefully to a full state-like Medicare program, not just in terms of money, but in terms of services to our citizens. My time is up. This time I yield to the ranking member, Ms. Gonzalez Colon.
Thank you, Mr. Chairman.